everyone, welcome back to Neurospicy Nursing. Here is the long-awaited cystic fibrosis lecture, and let's get on into it. All right, so if we had to describe cystic fibrosis in really one sentence, it would be that it's an autosomal recessive disorder. If you don't know what that means, go ahead and check that lecture that I did on genetics and genomics where I talk about what it means to be recessive. But really quickly, you need two copies of the gene. They will have thick and sticky mucus everywhere in their intestines, in their lungs, in their reproductive tract, just everywhere. CF is going to equal malabsorption, chronic infection, and mucus. That's really the smallest synopsis that I can give. So pathophys, they're going to have a defective, what we call CFRT protein. Obviously, we already talked about those thick secretions are going to block all of those important ducts. They will have an elevated sweat chloride test, which is important for the diagnosis of CF. They will have a poor clearance in their airway, so chronic coughing, chronic mucus, all of that because of, you know, all of the mucus, and chronic bacterial colonization. Thick mucus, bacteria gets trapped in it, and then there's a chronic cycle of being sick, getting better, being sick, getting better. It is an autoimmunity, so it makes sense. All right, clinical presentation. You will see all of the different, what were they called again? Abnormal lung sounds. They have a specific word for it, but all of the abnormal lung sounds, you will hear them. Um, and you will also see something called clubbing, and it's because of chronic hypoxia. And they'll also have a chronic cough. GI, they have staturia. So if we think about that, right, that blocked duct, the bile duct gets blocked too, right? So they can end up with those greasy, fatty stools from that. Meconium ileus. So when they are first born, they won't pass that meconium. It could be up to 48 hours, right? Or they have to actually go in and like make sure they get it out. But very common that when they're first born that they don't pass meconium at all. And then they can also have a rectal prolapse. Their skin is salty, like not tears, not sweat. Their normal skin is very, very salty, and that's where that sweat chloride test comes into play, is that for that salty skin. Also, they will look very thin. They'll have a barrel chest, like what you see in like emphysema patients, COPD patients, and also a distended abdomen, especially if they're constantly having ileuses, right? It makes sense for them to have a little bit of that distended abdomen. And then for the reproductive system, they tend to have infertility just because of that very, very thick mucus. In infants, patients with CF tend to also get failure to thrive. So if you have failure to thrive and that salty skin, you're definitely going to be thinking cystic fibrosis. All right, so the management of CF. Lots of bronchodilators, lots of airway clearance therapy, that chest physiotherapy, either your hand smacking their back or they have like machines now that do it. It looks very aggressive, I will say, when you're seeing chest PT, but you have to think like you kind of have to do it hard to loosen the mucus, unfortunately. Mucolytics and then antibiotics. Obviously, antibiotics are gonna be for those chronic infections that they keep getting. GI, they will need pancreatic enzymes. So when you have cystic fibrosis, you kind of end up getting kind of like almost it seems like like it's diabetes. It's obviously not diabetes, right? Because they are not having full-blown beta cell removal, right? But it could be very, very similar where high glucose levels, they need pancreatic enzymes, they can't process anything. Um, and a good chunk of them actually do end up being on insulin. Um, High calorie, high protein diet, that protein is also going to kind of help with like healing in general, right? If you think of constantly being sick, a lot of people with autoimmune diseases normally tend to need higher protein diets, um, just because it kind of helps our bodies re-heal. And then vitamins, of course. All right, nurses, role and complications. We're going to prevent pulmonary infections. There is a whole lecture on respiratory infections and all of the vaccines that you can get to help prevent them. They will get the vaccines just as long as they're not live. We're not doing any live vaccines for them because of their autoimmunity. We're going to support their nutrition. If they know someone else that has cystic fibrosis, they need to stay 6 feet apart. You will see a test question on it. If there is one cystic fibrosis patient, they need to be 6 feet apart or more from the other cystic fibrosis patient. If they're in a room and they can only be 3 feet apart, they will not be in the same room. You may end up seeing a question like that. All right, and then the familial support, it's a big, really, really big one because especially in autosomal recessive, which means that you need to have two copies of that gene, they tend to blame themselves, being like, "Oh my God, I can't believe that I didn't know that I had this." Um, and they blame themselves, it's not necessarily their fault. Um, Sometimes genetic testing can help kind of prevent it, but you have like a 1 in 4 chance either way. You know what I mean? But you know, just remember that it's very difficult. And some people may not understand the whole, and two, genetic testing just in general is very expensive, but may not understand, the reasons why. And then on top of that, now they have to care for a chronically ill child in a very tough financial situation that can put a huge burden on someone. So that's kind of everything familial support. There's a lot of complications with cystic fibrosis. Pancreatitis, diabetes can also be a causation of that those thick secretions. I said there's a diabetes like I mentioned in the last slide, diabetes like, but if there is enough damage to that pancreas, yes, they can actually end up with diabetes. But it all depends on the level of damage to the pancreas and how much prevention that we're doing, right? Pneumothorax is another thing. And then constant pneumonia, constant bronchitis, that sort of thing. CF is lifelong. They're not just gonna wake up one day and it's gonna be gone. It's forever. Um, and us being consistent with their treatment is what's gonna help them stay alive. And, the biggest thing to remember with CF when you're talking to these kids, group support, huge thing, especially for families and kids, right? Obviously, if they're a kid in group support for CF, 6 feet apart is still regulated, but it still helps, right? Because it helps them realize I'm not the only one going through this. And I can do great things, even with this very, very sad disease that I have. All right, resources, and that's it. I have a full immunity lecture that should be going up tomorrow. But yeah, that's all I have for you guys. That one was a little bit hard at the end. I'm sorry. I get a little sad when I talk about cystic fibrosis, because I did have a patient that had CF. They were an adult by the time I had them, but it was very, very hard for me to see them and see them struggle. So it's something that's kind of very close to me, because I did feel like I made a little bit of an impact in that person's life. But yeah. Um, that's all I have for you guys today. Thank you so much and have a great day.